Good evening, and thank you for letting me present my findings for the Strategic Management Process Model and Practice, a case study approach to evaluate workforce focus in human resources, component of the Baldrige National Quality Criteria for Performance Excellence. That's a mouthful. My name is George Perrett, and I'm in Houston, Texas. I've always been a fan of performance improvement, stemming from my father's Six Sigma black belt work in the oil and gas industry. As a kid, that's not what I thought it was, but now it's given me some extraordinary insights to the strategic management process and the national award given to the best of the best. My company to evaluate was Memorial Hospital and Healthcare System in Jasper, Indiana. Honestly, I thought it was the Memorial Hospital System in Houston, but what the heck. Memorial is one of those not-for-profit hospitals run by the, quote, Little Company of Mary Sisters, originally a group of nuns who established the hospital 70 years ago. Similar to the Sisters of Charity that run hospitals throughout Texas and Louisiana's Christus, Memorial Jasper has a faith-based approach to management and their stewardship to humankind. The 137-bed hospital that serves Jasper, Indiana, and the surrounding rural communities through a network of outreach clinics, providing both inpatient and outpatient services ranging from pediatrics to geriatrics and all the afflictions in between. This is a company committed to quality for its very survival. In most rural areas, these hospitals are fine, but in the times of crisis, people turn to larger cities for a multitude of reasons. So, to survive, Memorial needed to deliver quality to the residents they serve. This commitment keeps the hospital on the national charts as a top 20 rural hospital by U.S. News and World Report, and more importantly, the National Quality Award that we'll discuss later. Quality in healthcare means one thing: workforce. Everybody has the same machines, the latest technology, but here in the healthcare industry, it's the people who make the difference. To support their people so critical to quality, the hospital provides some of the best training, development, benefits, and motivators to accomplish their goal of being the employer of choice in Indiana. There's 1,700 employees that make up the medical support and administration departments, are a unique blend of non-union and, for the most part, white and female workers. These women are engaged in everything from patient care, strategic planning, and achieving the mission, which is, and I quote, Christ's healing mission of compassion empowers us to be for others through quality and excellence, unquote. Even their mission statement has quality and excellence in it. This is truly an inspiring place to work at and to study. Their core competency is not like most hospitals, which is don't kill anybody, but rather being there for others and cultivating collaboration is at the top of their pyramid. Everything this company does relates to the steps of this pyramid. If a process does not support or enhance the covenants, core values, it doesn't happen at all. Here, the strategic management process for Memorial is spelled out. It is very heavy on the human resources component. Everyone is charged with collecting inputs, from conducting face-to-face voice of the customer sessions with patients to participating in multiple surveys from both inside and outside the company. Further, and I found this fascinating, are the best practice visits that employees make to other hospitals and to other Baldrige Award winners. Every fall, the leadership develops and refines their ongoing strategy and supports it in every way possible. Everybody at Memorial, from the doctors to the janitors, are trained on all the steps and components of the strategic plan and how they personally fit into those goals. An integral part of building the culture of empowerment and vision within the organization. Beginning in the new year, the company deploys their new strategy, decking out the staff with all sorts of items to reflect the goal for the current year. For example, this year, the core competency is closer to you, emphasizing the local services in these trying times. Everybody has this motto on their person, from the scrub suits to the ID cards the administrators carry. Again, every core competency resonates through the mission pyramid, supporting the core values of their covenants and tasks. The tasks on the strategic plan are broken down into bite-sized increments, such as, and I found this fascinating, a strategic plan on a page, a one-day synopsis of what the strategic plan should be. Also, 90-day action plans and other things that ultimately end up on the department scorecards. This firm has so many interesting implementation plans. I could talk about it all day. However, we're here to discuss the Baldrige as an achievement of excellence in strategic management. So let's talk about the relationship between the two. First of all, this is a one-way street. To even be considered for the National Quality Award, you've got to master the strategic management process. Here, your HR group is to prove that everyone has the proper competencies, meaning the will to achieve and the skills to achieve, and the culture that everyone participates. Once everyone is on board, the S&P has to show progress, and at this level, it's top performance of all of your peers nationally. Once that level of operational excellence is sustainable, only then should you consider the application process for the Baldrige. Think of it this way. The Baldrige is a summary report for all you achieved in S&P across the company. They want to see the Baldrige application wants to see the actions of the customers, the leadership, the workforce, the operation, and most importantly, the results. The results here are the key to success. Memorial shows their results as top decile or benchmark on almost all categories of results. But like the S&P, the Baldrige is heavy on the HR department. Here, all those mundane, routine HR tasks have to come under the quality microscope. Now, recruiting, benefits, payroll, job analysis, job design, performance management, labor relations, all have to be aligned towards the common vision. Here, you have to build the capabilities, skills, and knowledge. You have to track the actions such as turnover, absenteeism, and productivity to ultimately move the needle on performance, which is based by productivity, quality, and profitability. But why do we have the Baldrige? Well, according to my dad, the 1980s were challenging in the United States. Global competition really impacted American manufacturers, as evidenced by the auto industry. Japan was kicking our butts on quality. Hondas were coming over, competing with K cars. The Japanese Deming methods used for quality produced exponentially better cars for less than American manufacturers. Soon, other industries fell to global competition as well. So Ronald Reagan encouraged then Commerce Secretary Malcolm Baldrige to establish a quality campaign that now bears his name. Originally designed for the manufacturing and small businesses, the award is now expanded to include education and healthcare, which are much more HR intensive businesses. On this slide, the quality award shows the interaction between the 7 criteria, and it's important to point out that all of these levels have to interact with the other levels. Quality is a living culture that must be developed, implemented, and refined to keep sustaining. It is not simply a mandate from leadership. As I mentioned earlier, results are everything in the memorial applications, and they know how to measure and telegraph their success to the evaluators. Here, for example, the hospitals measure everything from patient safety to net promoter scores, asking how likely you would be to recommend Memorial to others. Furthermore, all the HR results are highlighted as including turnover rates, employee engagement indexes, pride in the organization surveys, and a feeling of accomplishment, which is somehow out of a survey. I've yet to figure that one out. But the hospital also must show results relating to all aspects of the 7 criteria. And in Memorial's case, they go to extremes, showing how their mission improves their community, the financial stewardship of their public trust, and even how much recycling they do to protect the environment. But I found this particularly interesting as part of that breaking down the mission into individual projects. Here, using a 90-day project and a Lean Six Sigma team, they were able to establish returns on investments for a bunch of changes that they made over a 1 quarter period. And now they show the actual ROIs, for the year. Memorial is truly a worthy recipient of the healthcare vertical for the National Quality Award. And if that drive there still exists, they will be a recipient once again. Thank you for your time and attention, and I hope you found this as interesting as I did.